So our today's lecture of skull, basically for practical examination. So the bony skeleton of head is termed as skull, and it consists of around 22 bones and 6 ear ossicles, so total 28 bones, and it can be divided into two parts, the cranial and the facial skeleton. And except mandibles, all the bones are connected by sutures and chondrosis and are immobile. Mandible is making synovial joint with temporal bone, so temporomandibular joint is a synovial joint, and it is the only mobile bone here. The plain sutures example is internasal suture, coronal is serrate, lambdoid is denticulate, parietotemporal is squamous, and for skin dialysis, rostrum of sphenoid is articulating with ella of Vomer here, you see. Now these are the two subdivisions of the skull, the neurocranium and the viscerocranium. Neurocranium, also known as the cranial skeleton. This part is the cranial vault, and which is forming basically the brain box, and it is attached to the base below. So the whole box is formed by vault and base. Now you will see here, this is the viscerocranium. The lower anterior part of the facial skeleton is formed by these bones named as viscerocranium or splanchnicranium. So what is the function? The function is to provide protection to the brain and covering meninges, and it also provides cavities for accommodation of organs like special senses, sight, hearing, equilibrium, smell and taste. And there are openings for passage of air and food, and also providing teeth attachment and like basically both the jaw for mastication. Now the bones in neurocranium are paired, that is parietal, temporal, malleus incus and stipes. Unpaired are the frontal, the occipital, the sphenoid and the ethmoid bones. Here you can see this is unpaired bone, the frontal bone and the occipital bone, the sphenoid and this ethmoid bone. Now the paired ones you can see are as the temporal and the parietal in the neurocranium. Now before we proceed to the facial skeleton, we can see the Monro-Cayley doctrine. As we know, the neurocranium or brain box is a rigid box and the volume is constant. It is lodging CSF, brain and blood. So to maintain a dynamic equilibrium, if any of these three increase, two has to decrease in volume or size. Now if nature has provided valvulus emissary vein to communicate and adjust the intracranial pressure, and basically these emissary veins pass through the cranial foramen and communicate intracranial venous sinuses with the extracranial veins, and that's how subserving the admirable function of adjusting intracranial pressure. But if any space occupying lesion is present, so it is going to compress the brain and leading into devastating results. So this can be asked to PGs mostly. Now the facial skeleton, bones forming facial skeleton are paired mostly, maxilla, zygomatic, nasal, lacrimal, palatine and inferior nasal conchae. And the superior nasal conchae and middle nasal conchae were part of ethmoid, so they were part of the neurocranium. Now vomer and mandible are the unpaired bones. Here you can see these are the paired bones, the maxilla, the inferior nasal conchae, the nasal bones, the lacrimal bones here, the zygomatic bones, and you can see the pink color mandible and the vomer are unpaired bone. One more paired bone is the palatine bone, which we are seeing here. It is forming posterior 1/3 of the hard palate. You have seen it earlier also. To keep skull in anatomical position, we keep it in Frankfurt's plane. This is the red line, which is Frankfurt's plane, passing from inferior orbital margin to the superior or upper margin of external acoustic meatus, and the other plane is described here as Reed's plane, which is also passing from the inferior orbital margin, intraorbital margin, and the posterior it is passing to the center of external acoustic meatus, that is also known as auricular point. And to study skull, we see as a whole, it has to be studied in different normas or views. So 5 anatomical normas are very important. So the frontal, if you are seeing skull from front, norma frontalis. from top, Norma verticalis, from lateral aspect, Norma lateralis, from posterior aspect, Norma occipitalis, and from inferior aspect is Norma Basalis. You see the Norma verticalis. Now here bones and sutures very easily seen are frontal, the parietal, some part of occipital bone. So here see, this is the squamous part of the frontal here seen, and this is coronal suture, this is the sagittal suture, this is the lambdoid suture, this is known as bregma. Here you can see the bregma, the meeting point of coronal and sagittal, and this is lambda, a shape of lambda between the sagittal and the lambdoid suture. Now here you see sometimes in frontal region you will see the metopic suture. Sometimes the remnant of metopic suture can be seen here. Basically the metopic suture is present till 2 years of age, and after 2 years these two frontal bones fuse to form one, and in adults it's an unpaired bone. You have seen that. And sometimes you will see isolated sutural bones present in these sutures. Now, so most importantly in this region, lambda region, you can see the bone inca, not of much importance for you. Now what is important is bregma and parietal eminence. You will see the parietal eminence, the parietal tuber, the area of maximum convexity of the parietal bone, and vertex will be the highest point, and which will be about like it will be on the sagittal suture and few centimeters away from the bregma. If you will come here somewhere will be the highest point. And parietal foramina, you can see here also parietal foramina about 2.5 to 3 centimeter in front of the lambda, these parietal foramina. And what is obelion? Basically this area between these two parietal foramina is known as obelion. Now coming on to the Norma occipitalis, you can see parietal bones, the squamous part of occipital bone, the mastoid part of temporal bone, the lambdoid suture part of the sagittal suture, and beside that you can see between mastoid and occipit, that is your occipitomastoid suture, and this is parietomastoid suture. So these two sutures. Beside that you can see there is one prominent projection that is known as external occipital protuberance, from which two lines are seen. These are superior nuchal line. Above superior nuchal line 1 centimeter above you can see this highest nuchal line, and extending from external occipital protuberance to foramen magnum, this crest is known as external occipital crest. And inferior nuchal lines can be seen here from the midpoint of the external occipital crest. These inferior nuchal lines can be seen here. So you can see the mastoid foramina here, which is present near occipitomastoid suture. Now coming on to the Norma frontalis. Basically it has the frontal region, and this is the orbital region. In frontal region what is important, and is basically squamous part of the frontal bone which is forming it. And here you will see there are two openings. These are known as the orbital opening of the face, and it is forming the supraorbital margin. You can see this is supraorbital margin, entirely formed by frontal bone. And here lateral 2/3 and medial 1/3 junction, you can see this supraorbital notch or foramina. The supraorbital nerves and vessels pass through. The lateral orbital margin is being formed by the zygomatic bone, and frontal process of, and this is frontal process of zygomatic bone and zygomatic process of frontal bone. So basically they are forming the lateral orbital margin. The infraorbital margin is formed by zygomatic bone laterally and maxilla medially. So this is maxilla, this is zygomatic bone. The medial orbital margin is ill defined compared to all this. So here it is formed by the frontal bone. You can see this is the frontal bone above, and lacrimal crest below here. So the lacrimal crest and frontal bone are forming this medial orbital margin. Now you can see the supraorbital foramen you have seen here, and here you can see the infraorbital foramen. Now the very important feature you're getting to see is two nasal bones connecting to each other forming the external architecture of the nose, bony architecture of the nose. This is internasal suture, and it is the nasal bones are articulating with the frontal bone by frontonasal sutures, and this junction is known as nasion. Now, if you will see, this pyriform aperture is external nasal aperture. So superiorly it is bounded by, you can see the nasal bone, and here inferiorly the maxilla is forming its lateral margins like this. Inferiorly you will see there is one very important spine that is known as anterior nasal spine. This is sharp bony projection, and it is informed here, it is okay. Now you will see the alveolar process of the maxilla, and similarly you can see the lower jaw is formed by the mandible here. Now laterally if we move, we can see the zygomatic bones, and these are the zygomatic bones. The zygomatic bone is articulating with maxilla here, and zygomatic bone is articulating with the frontal bone here. Now bones and sutures, we have talked about the frontal bone, we have seen the nasal bone, we have seen the maxilla, we have seen the zygomatic bone, the mandible. If we see the frontonasal suture, we have seen an internasal suture also we have seen. The glabella is basically a median elevation above the nasion and between the superciliary arch. So this is the glabella. Nasion is, we have talked about. Antenasal spine we have talked about. If move in midline, this is the symphysis menti, and this is mental protuberance or gnathion. Now you will see there are these three foramina are lying in same vertical plane: the supraorbital foramen, the infraorbital foramen, and the mental foramen. Now from Norma Basalis clinical relation, if you'll see, the Leaford fractures are important to know. This A is representing the Leaford 1, B is Leaford 2, and C is Leaford 3. So what is A? What is this Leaford 1? In this there is a horizontal fracture which runs along the floor of the nose and parallel to the palates and below the zygomatic bone. So you will see the floating maxilla condition can be seen here. It will be separated from here. The maxilla will be separated. The Leaford 2 fractures, basically the road traffic accidents, the impact is from the front. All these fractures you will get to see. So B is representing the Leaford 2. It is a pyramidal shaped fracture. The line passes through the root of the nose, the floor of the orbit, and towards the alveolar margin on both the sides. And the third is the craniofacial dysfunction. Basically the cranium and the facial skeleton will be separated from each other. They will not be in sync. This is the root of the nose. The fracture line is passing to the root of the nose, the superior orbital fissure, and the lateral wall of the orbits. So there is complete separation of the cranial and facial skeleton. Now coming on to the Norma lateralis. In Norma lateralis, you will see very important bones, but I don't think these are of importance because we all know this is the coronal suture, that is the lambdoid suture. We can see this is parieto-squamous suture, and the temporal lines are of importance because you see from here temporal line extends. Like there are two lines, but initially there is only temporal line. It commences at the frontal process of the zygomatic bone, arches over upward and backward across the parietal bone, where it splits into superior and inferior temporal lines. So basically you see the superior temporal line fades away posteriorly as we go, but inferior temporal line is becoming prominent to form the supramastoid crest. And basically the supramastoid crest will become continuous with the superior root of the zygomatic process. Now this zygomatic arch you can see here is formed by the zygomatic process of the temporal process of the zygomatic bone and zygomatic process of the temporal bone. So this is zygomatic arch and this is frontozygomatic suture. Yes, here you can see, no, this is not fronto, this is frontozygomatic. This is the suture between the zygomatic and the temporal bone. Now here you will see all the parts in very important, but the external acoustic matrix, you can see it is opening here, and roof and upper part of the posterior wall are formed by squamous part of the temporal bone. And the suprameatal triangle you will see is very important part. Yes, here this is the suprameatal triangle, and it is a triangular depression which is marking, it is the surgical landmark for mastoid antrum surgery, and about 1.2 centimeter beneath this lies the this mastoid antrum. So superiorly you can see it is the margin formed by supramastoid crest, and anteriorly you can see the posterior superior aspect, the external acoustic meatus, and posteriorly we draw imaginary line. This triangle is marking the location of mastoid antrum. It is very important surgically. Sometimes you will see a small projection, that is suprameatal spine at antero inferior aspect. Here somewhere you can see the spine of Henle, but here it is not seen. Now coming on to the two more important factors which we forgot to discuss. These two very important points which are commonly asked in Viva, the pterion and the asterion. And one more thing, if you remove the zygomatic process, you will get to see this pterygomaxillary fissure. Basically this fissure is communication between intratemporal fossa and pterygopalatine fossa. And here we are going to discuss this pterion and asterion. So basically asterion you can see is a meeting point of perithomastoid, occipitomastoid and lambdoid suture. So this is your lambdoid suture, and this is perithomastoid suture and occipitomastoid suture. So all these sutures are meeting here, or you can say the parietal, the occipital and the mastoid bones, the temporal part, temporal se yaari mastoid, so they are meeting here. Now you can see the styloid process here, the temporal fossa we are not going to discuss. Now what is important is here pterion. Pterion is H-shaped suture, and it is formed by the parietal, the frontal, the sphenoid, the temporal. And if we see, if you want to locate it, so if you from frontozygomatic suture, if we see 2.5 centimeter posteriorly, we can mark this, or from the center point of the zygomatic arch we move 4 centimeter above, we can mark it. So these are some surface landmark methods, and there is one more method given in other books, but we are not going to discuss that. Now what is the significance of the pterion? What lies here? So basically the pterion is representing like it, a middle meningeal artery, middle anterior division of middle meningeal artery, the middle meningeal vein and stem of lateral sulcus of brain are lying deep to pterion. So what is the significance of asterion? Basically asterion is representing the junction between the transverse and sigmoid venous sinuses, and basically the entry for the neurosurgeon take it as entry point for posterior cranial fossa surgeries. So this can be asked. Here you can see how this anterior division of middle meningeal artery is passing in relation to the pterion. Suprameatal triangle we earlier discussed. Norma Basalis is very important, especially अभी तक जितना पढ़ाया उसमें सबसे ज़्यादा Norma Basalis से ही क्वेश्चन पूछे जाते हैं. तो we can do one thing, we can divide the whole Norma Basalis into three parts by two imaginary line. This is one imaginary line, this is another imaginary line. So the anterior transverse line is basically passing along the posterior free margin of the hard palate, here you can see, and the posterior transverse line is passing along the anterior margin of the foramen magnum. Now you will see the anterior part. In anterior part, here you can see the alveolar arch. This is U-shaped arch providing sockets for the root of the upper jaw teeth, and this is hard palate. This is the palatine process of maxilla forming anterior 2/3 of hard palate. This is horizontal plate of palatine bone forming posterior 1/3 of the hard palate. Here you will see this is incisive foramen. here the intermaxillary suture, the interpalatine suture, palatomaxillary suture, greater palatine foramen, lesser palatine foramen. And as we move in midline, you can see the posterior border of the vomer, the two posterior nasal aperture. These are the posterior nasal aperture. Now this is the pterygoid process here, and the pterygoid process will be giving origin to the two plates. This is the lateral pterygoid plate, sorry, medial pterygoid plate, and this is the lateral pterygoid plate. Here you can see the scaphoid fossa here, and in midline, one more thing you will see, this is the bony bar. This bony bar is basically formed by the body, some part of the body of sphenoid and basilar part of the occipital bone. Here very important part you will see as pharyngeal tubercle, which is giving providing attachment to the pharyngeal raphe, and which in turn gives attachment to the constrictors of the pharynx. And now coming on to the foraminas, which we are seeing here in lateral part, are the foramen ovale, the foramen spinosum, and just posterior to it you will see the spine of sphenoid. And what is sulcus this area is sulcus tubae between the petrous and greater wing of sphenoid. So this is sulcus tubae. Now foramen lacerum is seen here. Basically this is the petrous temporal bone, and this is the apex of petrous temporal bone where this foramen lacerum is shown here. Now here is your here you can see the styloid process, the jugular foramen between the petrous and the occipital bone. So this is your, like this four petrous and occipital fissure is here, the lateral part is jugular foramen. And now we are moving to the posterior part. In midline area from before backward we can see is the foramen magnum, and the external occipital crest, the external occipital protuberance, and in lateral area you can see the occipital condyles, and the hypoglossal canal not very nicely seen here. The posterior condylar canal or the condylar canal, this is the jugular process of the occipital bone, basically just lateral to these condyles. This is jugular process of occipital bone. The tympanic canaliculus, the all these things I'm not going to discuss here. The stylomastoid foramen is basically seen here. This is stylomastoid foramen. So this was all about Norma Basalis. Now we will go one by one. You see these two foramen, the foramen ovale, the foramen spinosum, we were seeing in the greater wing of sphenoid. So this is the greater wing of sphenoid, you can see here. And from when you will see the skull from interior aspect, the foramen rotundum also you'll see. Now here you can't see Norma Basalis from external aspect, you can't see the foramen rotundum. Now foramina in Norma Basalis you have seen are the incisive foramen, the greater and lesser palatine foramen, the foramen ovale, the foramen spinosum, foramen lacerum, squamotympanic fissure, carotid canal, foramen magnum, hypoglossal canal, condylar fossa, jugular foramen, and stylomastoid foramen. And so these are the only important ones.